Natalie Gunning. I'm a physical therapist with Spalding University. Today we're going to touch base on a condition called Bppv, which is benign paroxysmal positional vertigo, which is a mouthful, which basically means you suffer from sudden acutes of vertigo, which is also dizziness. So whenever you change positions or transition, you're suddenly getting dizzy, where it makes like the room is spinning around you or you're spinning around the room. Usually this only lasts for 30 seconds or so, and it goes away until you either lay down or change your positions again, look up, look down. If anyone's experienced this, you can know it can be extremely debilitating. It's super uncomfortable. It can make you nauseous, sick, make it unsafe to drive. So I'm going to show you a little maneuver called the Bppv maneuver. This is a maneuver you can do at home to help self-treat Bppv. So our ears are made up of all these semicircular canals that have these little crystals called otoconia in them. And what they do, whenever you turn your head, look up and down, these little crystals float. So they send the message to your brain and your eyes like, oh, we need to turn this way. Oh, we need to go that way. For some reason, these crystals can get dislodged at times. So sometimes I might be twisting this way and my crystal's not moving like it should. It's going that way. So it's confusing the brain, and that's what causes the dizziness. So these are positional maneuvers that you do that are trying to get those little otoconia, those little crystal stones, back in the correct semicircular canal, so that way you don't have dizziness whenever you change positions. Again, please clear this with your physician before you perform any of these activities. Make sure that you have a bucket nearby. There is a chance you might get sick or vomit, and I would not perform these if you're home alone, because again, they can make you dizzier sometimes, and you don't want to be in a position where you need help and there's no one there to help you. So anyways, go ahead and grab your trash can and we'll get started. So the maneuver I'm going to show you today is the self-Bppv test. You need a flat, firm surface and a pillow, because you do have to take your head into some extension. And you also need to have neck range of motion. So if you're having difficulty looking up or twisting to the right, this maneuver may not be good for you. You also need to clear with your doctor or physical therapist which ear is affected, because we need to start with the affected side first. So we're going to pretend I'm having issues with my right side. So I'm going to lay down. I'm going to turn my head to the right. This pillow is going to be under my shoulders. So head to the right, and then I'm going to lay down quickly. Once you lay down, your neck's going to be in slight extension. You're probably going to have some dizziness, spinning sensation. So we're going to lay here until all that subsides. Once the dizziness and spinning subsides, you're going to wait another 30 seconds to a minute. So you'll lay here, lay here, lay here. Well, again, my dizziness subsided. I waited a minute. Now you're going to turn your head all the way the other direction without lifting it up off this. So we're going to turn all the way over this way. Same thing, you might have dizziness, spinning sensation. Even if you don't, you need to wait here at least a minute. So it's either wait a minute or a minute after the dizziness goes away. So dizziness went away, I waited a minute. We're now going to turn on our side, still keeping our head down. So you might have to use your hand a little bit. So my chin is tucked, I'm now on my side, but I did not move my head at all. Again, you might feel dizzy, have a spinning sensation. We're going to wait at least a minute or a minute after the dizziness subsides. Finally, you're going to use your hand, you're going to keep your chin tucked, you're going to push yourself up. Wait a minute, and then relax. Hopefully this will alleviate some of your dizziness symptoms. Sometimes it takes a couple times to do it. However, I would stick with an Bppv once a day. You also may want to have a trash can close by, because sometimes this can make you sick. If you have any questions, feel free to email me at ngunning@spalding.edu, and you take care.